Hi, and welcome to Fairview Range Focus. I'm David Hall, Chief Administrative Officer here in Hibbing. During this monthly segment, we talk about health topics that affect our community. Today, we're going to be talking about a couple different areas, in part related to the Rehab Services Department and in part related to cancer treatment. And I am joined by Nancy Hukka, who is an occupational therapist, and Tina Dusold, Speech-Language Pathologist. Thanks for joining me.
Thank you.
So let's start and talk a little bit about rehab services a little bit.
Okay.
And I know we're going to kind of focus on about oncology, but maybe just to kind of give context, you can talk a little bit about what is rehab services? Who makes that up?
Okay. Well, we have physical therapy, occupational therapy, speech pathology, and we actually have cardiac rehab within our department as well.
Okay.
Many times people say, well, what's the difference between PT and OT? In physical therapy, folks are working a lot on strength, balance, endurance, maybe working after a total knee or a total hip injury, working on getting motion back in their joints. In occupational therapy, I'm more focused on patients' levels of independence. Can they dress themselves? Can they make dinner for themselves? So in a rehab setting, say of a stroke patient. But I also do hand therapy, so I'm working on getting people's hands moving better and stronger and being able to use them so that they can dress themselves, can prepare their meals. And I also treat lymphedema, which is an excessive swelling of a limb. And so I can work with people to help get that back under control so they can manage that. And then I'm going to let Tina talk about speech therapy.
Okay.
Yeah, and we'll touch a little bit more on that, but with the speech therapy, I work with communication disorders, voice disorders, and swallowing disorders.
Okay.
So very general.
Okay. And you treat all ages?
All ages, yep. Birth through death.
Okay.
Pretty much, yeah.
Birth to death,
Yeah.
all right.
The whole gamut.
Okay.
Yep.
So, and I know we want to talk a lot about the cancer care and how the rehab services plays a role in that. So Nancy, maybe you could start and just kind of describe for us a little bit about what is that interaction between the two services.
Okay. Well, we've always offered rehabilitation to all sorts of patients, whatever their diagnosis may be, including cancer diagnoses. However, the Commission on Cancer has really been encouraging facilities, doctors, and other providers and patients to utilize rehabilitation much more than it has been. They have done studies that find up to 90% of patients with cancer would benefit from rehabilitation in some form. People dealing with fatigue, weakness due to their cancer, cognitive problems due to their cancer, difficulty managing everyday life due to their cancer. And I mentioned that in my intro about occupational therapy, working with people to be able to do things. Well, if you're so fatigued from your cancer that it's very hard to maintain your regular schedule, maybe it's including child care and home care and you have to work. So we work with people to try to help them kind of schedule their days, budget their time and energy, maybe use modifications of how they do things or modifications of the tools that they might use to help them accomplish a certain task. So, that would be really with occupational therapy quite a lot. In physical therapy with cancer rehab, they can work with people on improving their strength, improving their endurance, getting them in an exercise program. Exercise has so many benefits. It's kind of hard to get into a routine sometimes, and people have a lot of reasons why not to when they're healthy. Now put cancer diagnoses on, and you're having to include getting to your doctor and getting to your treatments. You're feeling lousy. We put exercise into that routine. You can get stronger. You have better oxygenated blood. You get endorphins released, so you actually can feel a little bit better, even though you're dealing with so much other life with your cancer. So we really want to make sure that we're offering those services, which we have been, but they just haven't been utilized. So we want to make sure that people understand that a diagnosis of cancer would be an area that would be appropriate for rehabilitation as well.
Okay.
And again, I'm going to say to Tina, can you kind of talk about what speech
Yes.
therapy could do for your cancer patients?
Sure, absolutely. 90% of the cancer that I deal with is head and neck cancer. Whether there was a tumor in the throat, in your mouth, on your tongue somewhere, a lot of times things are removed, tumors are removed, leaving your neck and your mouth, your oral cavity, just not the way it used to be. So it makes talking and eating especially incredibly hard. So I work with patients to help get some of their speaking back, where maybe they're not being understood by family and loved ones as much as they used to be. I work with them to help get that back to where it used to be. And if we can't, if for whatever reason something has been removed too much, we can work with assistive devices that help the patient communicate so that they are able to communicate with their loved ones. On the swallowing side, I work with patients who, again, tumors, head, neck, mouth, changes kind of the structure of your throat and your mouth. So working with that patient to help them so that they can eat and they can enjoy that food again. And then also decreasing the time that they would have to be on a tube feeding if that is something that has to happen in their rehab at some point.
Seems like speech is something we kind of take for granted.
Absolutely.
It's just there all
Yep.
the time. So I can only imagine, I mean, as
Yes.
someone going through cancer, treatment, surgeries and so forth, what that impacts.
Yeah.
So have you had, patients you've been treating then who've been going through cancer?
Yes,
and so
again,
forth?
I don't think it's utilized as much as we would like. I know that head and neck cancer is a big thing. I mean, people smoke, we inhale things, everybody in our daily lives, we inhale things and we don't know how that affects our body. So yes, I work with it quite frequently, but definitely I think that there's more growth that can happen in that, and definitely things that can be done. I don't think people realize kind of the scope of what speech therapy can do to help them get back to eating their favorite food, whether their chocolate cake or even if it's just having a couple sips of a milkshake so that they can get that taste in their mouth again.
Eating is such a social
Yeah, definitely.
event in our lives,
Right,
and
right.
so it's important to be able to participate, not only for nutrition, but to socialize with people and to be a part of the things that are going on around us.
Now, maybe for both of you, I'm thinking, people who do have maybe surgery related to cancer and that it affects muscles, and sometimes the muscles can be impaired or removed from a surgery. So is there a relearning process? That someone can say that, well, I don't have the same muscles as I did, but I can relearn or use different muscles. Is that something that you play a part in, or does that occur?
I think our physical therapists might do that more
Okay.
often. But certainly, if you can't do something the way you used to, there's almost always a way to do it
Okay.
another way.
Mhm.
Right. And so, getting the muscles around the area that's been affected stronger so that you're supporting your joints and can move your joints, I certainly think, PT could do something like that. I think it's more usually that people get deconditioned and very weakened from the cancer itself or from the cancer treatment. And so that's where getting into an exercise program and strengthening your body so that you have the fortitude to go do the things that you want to do can really make a big difference.
Gina, do you
Definitely.
add anything?
In the speech area, in terms of swallowing as well, there's different compensations that you can do. We can change consistencies. We can turn heads one way or the other, tuck your chin, things like that. So moving even just your head and your body can make a big difference in the swallowing. And also the voice once in a while, but definitely the swallowing can be affected, and you can use different muscles, move different muscles to help affect your swallowing ability. Absolutely.
So I suppose whether it be speech or just walking or something, normal activities, we're used to doing it in a certain way. So I can imagine, like you said, it's kind of encouraging to think that there's always a different way to do it, maybe the same thing, maybe with a different approach or different.
Right,
so
right.
that's encouraging to hear.
Yeah.
Good.
Well, and two, if you're struggling with walking, maybe you don't know what adaptive equipment is out there available, because there's different styles of canes, different styles of walkers, different styles of wheelchairs that are out there that until you've needed it, you've never paid attention to it. So, yeah, that's where therapy can really make a difference in finding a piece of equipment that's going to allow you to maintain your independence or regain your independence but using like the least restrictive way to do that. I mentioned the walking devices, but there's also devices that can help someone hold utensils and toothbrushes and their razor, and there's devices that can keep your food on your plate, and there's devices that can help you button and pick things up off the floor. So
lots.
There's a lot.
Yeah. Yeah. Well, maybe I'm thinking, I mean, when somebody who has cancer enters within the Fairview Range, system, what happens? I mean, how do we connect with you, or if that's a service that we think, boy, my loved one would benefit from that, or I mean, how does that work? Can you describe that for us?
Well, we're really trying to improve that, because
Okay.
I think at this point, like we said, we're just not being utilized. So what we have been doing is trying to educate our nurse navigators who are very involved with our cancer patients, and giving them like a little screening tool to use so that they can ask the right questions. Are you having trouble getting dressed in the morning? Are you having trouble walking up the stairs? Are your loved ones having a difficult time understanding you? So to ask those probing questions. One of the comments they said is that a patient will walk into the doctor's office and be asked, how are things going? And they'll say, fine, and that's it. So those things aren't being brought to the attention sometimes. So our nurse navigators are going to be trying to ask those probing questions so that they can say to the doctor, whether it's the general practitioner or the oncologist, so-and-so said that she's really having a hard time getting dressed in the morning. An occupational therapy evaluation would be appropriate for her. And what we're trying to do is make it so that if somebody needs therapy, that they're going to get a cancer rehab order, and they'll get a physical therapy evaluation and an occupational therapy evaluation. At this point, speech therapy does need to be ordered separately. But after they get their evaluation, we treat everyone as individuals and find out, where are your strengths, where are your weaknesses, what can we help you with, and set up a plan that's specific to that person so that we're reaching the needs that are important to them. Because, it might be important to me to do a specific task independently, but someone else might say, you know what, I don't want to wash the dishes anymore. I'm fine with someone else taking care of that.
I understand.
Yeah.
Okay.
So, we need to make sure as therapists that our individual patients' needs are being met. And as the rehab department, trying to make sure that we're communicating with our providers, with our nurses, and through things like this with patients in the communities so that the right questions can be asked and the doctors can we do need orders from our doctors, and so we're working to make that happen.
Does insurance pay for the cancer rehab services?
Most insurances are pretty good about covering rehab services. We don't go and check each individual insurance carrier to say this is how many you can be seen. Most insurances, with a doctor's referral, will cover. Medicare, we do have to be careful with how many visits we do and make sure we're documenting appropriately. UCare, we know for sure we have to get approval after evaluation before we go forward with that. But most insurances, rehab is part of their coverage. And certainly any patient can call their own provider, insurance provider, and ask specifically, I've been referred to physical therapy or occupational therapy or speech pathology. Do I have coverage for that? And I encourage that because we don't want to add financial burdens to people as well as everything that they're already going through. But that is a patient's responsibility to find that out themselves.
Okay. All right. Good. Well, it's really interesting. It's really good to hear that our cancer treatment is kind of broadening and as far as offering some additional services to help support patients. And I don't want to miss the opportunity to talk a little bit more with Tina in regards to speech pathology. And I know that we waited a while to fill the position that you're in, and so there's not lots of speech pathologists all over. But maybe you can help educate us a little bit about speech pathology and what that is. Maybe start, education-wise. Where does that start? How does
I had a bachelor's degree in communication disorders and then a master's degree in communication disorders. Most speech therapists that you'll find should have a master's degree. You have to have a master's degree in order to be certified by the American Speech, Language, and Hearing Association. And that's what you want to look for when you're looking for a speech therapist. They are the accrediting agency that kind of monitors all speech therapists, what we do, and make sure that we're using the best practices with our patients, so that we're having research-backed treatments, so that we know that they're going to work, or how to change it if it's not working. Yeah.
Okay. So where did you go to school, may I ask?
St. Cloud State.
Okay. I think I've heard they have a real
Yes.
good program. It's been around for a few years.
Yeah, quite a while.
Yeah.
Yeah, just expanding it. So.
Okay,
Yeah.
great. And what types of patients do you see? Can you kind of speak to that as far as what type of disorders and?
Everything and anything to do with communication and swallowing. I work with children anywhere, my youngest right now is probably a year old, all the way up to, I see almost 18, 19-year-old kids for various things. When they're younger, they're typically language-based. So your child may not be speaking enough, 1 to 2 words instead of saying 50. We see these kids, and if you look at a kid who's normally developing, they don't stop talking, ever. They're always asking why, and they never stop. With kids who have a language disorder, you don't see that as often. They'll say mommy, daddy, yes, no, and that'll kind of be the end of it. So definitely something to look for. With my adults, it can be anything from a language disorder because they had a stroke, or because they had a traumatic brain injury. And those can also lead into swallowing disorders as well. With the strokes and the traumatic brain injuries, they can have disorders of swallowing. And like we spoke to earlier, the cancer, the head and neck cancer as well can lead to that. So also voice patients. This is something that I don't think people quite understand. I've had plenty of voice patients come to me and say, I had no idea that I needed to see a speech therapist. If you're hoarse or scratchy, or you feel like your quality of your voice has changed as you're getting older, or maybe you had an accident or injury, that is something that a speech therapist can help with, is to get that kind of hoarseness out of your voice.
That's very interesting.
Learn something new every day.
Every day.
And referrals. Do I need a referral, or
Yes.
do you?
Yep. Any patient who comes to speech therapy will need a doctor's referral.
Okay.
And that doctor's referral should say what you're coming in for. If it's a swallowing problem, should be referred for swallowing. If it's a speech problem, being referred for speech. Definitely just calling your doctor and asking for that is typically all that needs to be done.
And how long does treatment go on? Is there a typical or an average? Or?
With kids, it's kind of a hit and miss. Some kids just need that little bump and they pick it up within 6 months. Some kids, if they have underlying disorders such as Down syndrome or autism, tends to take them a little bit longer to kind of catch up to their peers. So they could be for a year or two with speech therapy. The nice thing with the kids is they can also be seeing speech therapy in the schools in conjunction with coming to see us in Fairview as an outpatient therapy source. Typically adults, a couple months, 1 or 2 months maybe, a couple times a week before they really, feel like they're ready to be done and going home independently.
It must be very rewarding.
It is.
Working with people that maybe
It is.
struggle and then can learn and improve. And
yes, I recently had a patient who was able to tell her mom for the first time in 5 years, I love you.
wow.
And yes, there were tears.
Cool. Oh,
it was very cool. Goosebumps and
Wow.
tears. And
Yeah.
yeah.
I've heard from parents, frequently new parents, that talk about their children and that say, well, gee, he doesn't talk, she doesn't talk. Is there, like they think they should, or at this stage they should.
Yeah.
Is there something you could say typically by this age they should be talking fluently, or?
Yeah, by 2, they should be saying 2-word phrases. By 3, 3-word phrases. So it kind of goes along with their age.
Okay.
If you're noticing that by 4, you're not understanding everything that they're saying, then that's definitely a red flag. About 4 years old, we want to be understanding 100% of what the kid is saying. Now, boys tend to be a little bit behind girls, so if you're comparing, you have an older daughter and now you've had a son and they're a little bit behind, sometimes that's very normal. The girl likes to talk for the younger son, and so it tends to be that they will come around sooner or after a little while. But yeah, I think that anytime that you're concerned about any of that, definitely have, even if it's just an evaluation, just for kind of reaffirming what you're doing with your child, that
Okay.
we can give you any kind of resources or guidance along the way.
Well, that's interesting to hear that two-word phrases
Typically, yeah.
related to the ages. So that's kind of nice of the
helpful.
guideline of
Yeah,
sorts.
an easy way to think about
Yeah,
it.
yeah, great. That's good. Thanks for sharing
Yeah,
that.
definitely.
Well, it sounds like, I mean, occupational therapy and speech pathology are very different in many respects, but yet you treat the same patients in many cases, such as the cancer patients. Where would that be true? That, I mean, that you might have a cancer patient that you're both working with?
Absolutely.
And another area that we both work on is cognition. I tend to work with people with cognitively, like, can you write a grocery list? Can you fill out a checkbook? That kind of thing. Where Tina does a lot of like
Memory, very higher level problem solving. You know, can you tell me how to solve this problem? Deductive reasoning, where you're looking at, if this happens, then what happens? So sometimes people with cancer and traumatic brain injury and strokes tend to have deficits in those areas.
yeah.
Very good.
Yeah.
Well, thank you. That pretty much wraps up our time for today. And it was really interesting to hear more about both speech pathology and occupational therapy, and really the cancer program and how those services really fit into cancer care and cancer treatment. So hopefully lots of people who need to hear that have heard that, and we'll talk to the doctors about that too, should that be something that they need in their lives. So thanks, both of you, for joining me today. It was fun to visit with you and learn more about that. So thank you for joining us today in Fairview Range Focus. And if you want more information on the services that we offer, you can visit our website, which is www.range.fairview.org. So thank you for watching, and watch next month for the next segment. Thanks very much.